It's 2:10 p.m. here in Seoul. I'm Yoon Jung-min at the Arirang News Center. We are breaking into our regular programming for a live COVID-19 briefing. We will be crossing over to the briefing with simultaneous interpretation in English. South Korea reported 505 new coronavirus cases on Saturday. It's the first time in over a month that the daily number of cases has been above 500. All but 15 were locally transmitted. Most cases were concentrated in the capital areas, but other regions have also recorded relatively high numbers. The briefing is just about to start. Have a look.
설명이 있겠습니다.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for March 27th. As of today midnight, we have 490 new local infections and 15 new imported cases. The total caseload now stands at 101,275. And yesterday we had 81,231 tests being conducted, and the makeshift testing sites in the metropolitan area we had 38,066 tests being conducted, confirming 82 cases. And we have 845 more people being discharged, while 6,079 still remain in quarantine. And we have 103 patients with critical or severe conditions. We had 5 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And here are our updates on the domestic infections, and these have been provided to you in advance in the press kits. And here are updates on our status on the COVID-19 vaccination. And yesterday alone, we had 22,845 more people being administered with their first dose of COVID-19 vaccines, with the number total standing at 792,274. And 5,232 people have also received their second dose of their vaccines. And yesterday alone, we also had about more than 10,000 people being administered with their first dose within our first target group, and our target rate stands at 84.2% as for the target, and about 92% for those who have given us the consent to get vaccinated. And by nursing hospitals, we also have many people getting vaccinated, and also as for the first responders, we have more than 69 people being administered with the first dose of the COVID-19 vaccination. And we are carrying out the COVID-19 hospitals, which are under the subject of the second dose of their COVID-19 vaccines. And also we have finished the inoculation for a significant amount of people there. And as for the seniors, citizens above the age of 65 at nursing hospitals, and we also have about 19% of these target group, with the total now standing at above 70,000. And as for the post-inoculation adverse responses, we have a total of 10,261 cases, and also 10,131 of them are mild and common symptoms, including muscle pain, headaches, and fever. And we have a total of 100 suspected cases of anaphylaxis, 9 suspected cases of severe cases, including convulsion, 21 cases of death, and we are under investigation, which will also be disclosing the results in a very transparent manner. And we also have the people who have been administered with their vaccinations, and also among these group of people who have also been reported for these people who have been confirmed to be infected after the infection. We also have some significant number of them as well. And also we have 36 facilities which are prone to virus infections after the inoculation. And we are also carrying out a comprehensive approach and analysis in the effectiveness of these inoculations. And on a global level, we are seeing a resurgence of the number number of outbreaks. And here in South Korea as well, we had a 400 range of the confirmed cases on a daily basis. And thus we are also continuing to take particular precautions. We believe that there would be many people visiting churches in person to also celebrate the Easter holiday. However, we ask you to also take particular precautions as well. And thanks to your support, we have seen many a big decrease in the number of cluster infections stemming from the places of worship. However, there were also people having group meals before or after these regular church services, which are also increasing the resurgence of the virus. So once again, we highlight that if you have symptoms like fever or coughing, please do not go to any crowded places, and this also includes churches and other places of worship. If you have any clinical symptoms, please visit a screening center nearby and get tested as soon as possible. Until you have your results of the testings, please wear your face mask at all times, even at home, and also keep social distancing even with your family members. And even if you go for in-person services, please do not have group meals together or have group gatherings. And we ask for the managers and the staff members at the churches to participate proactively in the quarantine measures. And on the 26th of February, we kicked off our inoculation starting from the nursing homes and nursing hospitals. And it has been a month since then. And we also recently began our second dose of the Pfizer vaccines. And we are also having a continued increase in the people who are receiving their second doses as well. And we ask for your continued participation in the inoculation campaign. And we also thank you for your cooperation in advance. And there are also many people, especially the medical staff members and the local authorities, who are exerting their efforts as well. We thank them once again. And starting from next week, we will also we have also been inoculating the people, senior people, especially over the age of 65. And we have been rolling out the vaccinations for them last week at the nursing hospitals, and starting from the 31st, we will be rolling out the vaccinations for them at long-term care centers. And starting from April 1st, we will begin the inoculation of seniors over the age of 75. And by regions, we will have phases of these inoculations based on their infrastructure, including the vaccination centers. And also, we are carrying out the analysis and the notifications of these reservations or the reservations for the inoculation. And we believe that there are many people who are still worried about the concerns or the possible risks of the infections or the vaccination. However, we have learned throughout the past year or so that the many people who have developed severe or critical symptoms had underlying illnesses. And we also want to highlight that these vaccination is the most effective measure to prohibit the symptoms from becoming severe or critical, and also to protect yourselves. So also take particular precautions of the senior family members as well. And on the 29th of March, we will be having an expert panel workshop for the inoculation. And this is being put in place to prepare for the rollout of the vaccination for seniors over the age of 75. We will be receiving their questions, and we will be addressing them with our panel of experts. And also, on a weekly basis, we have the post-inoculation adverse responses, which are being analyzed, and they are also being released via our press releases. And as for the adverse responses, please do not have an ambiguous level of these nervousness or anxiety, but we will be communicating with you based on scientific evidence and facts. And we believe that COVID-19 vaccines is the most effective and most scientific way to protect yourself and to contain the infections here in South Korea. So we ask you to get the inoculations if you are subject to the inoculation. And also, even after inoculation, please wear your face mask, wash your hands, and keep social distancing. And the quarantine authorities will also make sure that inoculation campaigns are carried out in a swift and safe manner. Thank you very much.
답변 드리는 시간 갖겠습니다. 현장에서 기자님 2분 질문 주셨습니다.
That wraps up our coverage of the briefing this afternoon. Thank you for staying with us. We will be back with our regular newscast at 6 p.m. Korea time. Goodbye.